Oh, hi there. I'm Chris Stoller.
And I'm Bailey Seidel.
And I'm Megan Nagelnitsky.
And I'm Maddie Toy.
Our video presentation is on healthcare in Haiti. We chose this country as most people are aware that Haiti is a land stricken by poverty and natural disaster. However, there is not a lot of understanding of the country's healthcare system.
Hello, I'm Maddie Toy from Channel 1 Press. Today I'm in Haiti finding out more information on their healthcare system. I'll be interviewing people from different professions to ask important questions about the healthcare system. To start, let's go over some background information on Haiti's history. In 1804, Haiti led the first slavery revolt led by Jean-Jacques Dessalines, becoming the first Black republic. Dessalines was named the emperor, but died 2 years later, causing a long period of instability, frequent regime change, and near anarchy. From the 1970s to 2004, Haiti encountered $1.2 billion of debt. As a result, the World Bank and International Monetary Fund created structural adjustment programs, including major cuts in the government expenditures on health and education. The last president was Michel Martelly. However, his run ended in February 2016. The current interim president is Jocelyn Purveyor, who originally was supposed to end his term in April 2016. However, the National Assembly of Haiti refused to meet to appoint a successor, so he remains the current president today. On November 20th, 2016, a new election will be held. It has been postponed 4 times in the past due to various reasons, including violence, fraud, and Hurricane Matthew. Now let's talk to some key people in the healthcare system. I have with me today Dr. Chris Stoller and Bailey Seidel, registered nurse from Partners in Health Hospital. How are you guys doing today?
Good, thank you for having us.
Yes, thank you.
So we're here today to talk about Haiti's healthcare system. What factors have influenced the system development in Haiti?
So essentially, Haiti is often defined by what it lacks. So a stable economy, high employment, solid infrastructure, and also access to quality food, clean water, and universal health care.
Haiti is one of the poorest countries in the Western world, with about 65% of the population living below the poverty line. There's a correlation between the poverty, the unemployment, and poor health, and all of these are seen in Haiti.
What about the hurricanes that have hit Haiti? What impact have they had on the healthcare system?
So between August and September of 2008, Haiti was actually hit by about 4 hurricanes. So this impacted the health system and economy in a great way. So the most recent hurricane, which we've seen in the news, Hurricane Matthew, this occurred on October 4th of 2016, and so there's a new recovery process going to be happening from that as well. So.
And wasn't there an earthquake that hit Haiti a few years ago?
Yeah, in 2010, I'm sure we all know that earthquake occurred, causing the loss of life of about 220,000 people, injuring 300,000 others. It scored 7.0 on the Richter scale, which is quite significant. The economic damage was estimated to be about $8 billion US, which is more than 120% of Haiti's GDP to begin with in 2009. For comparison, in 2015, their GDP was $8.8 billion, so you can imagine how much money was lost in this disaster. Also, since 60% of an already dysfunctional health system was destroyed in 2010, the country's healthcare system is still trying to recover today.
Wow, that's very interesting and devastating. Thanks for all your information.
Thank you.
Thank you.
Joining me now is a pharmacist from Partners in Health Hospital. Do you want to introduce yourself?
Hi, I'm Megan Nagelnitsky.
Nice to meet you.
Nice to meet you as well.
So I understand that there are different stakeholders who are crucial to the organization of Haiti's healthcare. Can you elaborate on the government stakeholders?
Yeah, so the United States has been a major stakeholder who has partnered with Haiti since the earthquake. Also, the Cuban and Brazilian government have also been assisting Haiti to help with rebuild the current health system.
Okay, what about non-governmental stakeholders?
Okay, so our hospital, which is Partner in Health, is one of the largest non-government healthcare providers in Haiti. It serves about 4.5 million people with a staff of 5,700. We have recorded more than 1.6 million patient visits, provided educational assistance to 9,400 children, delivered prenatal care to 30,000 pregnant women, and started 17,000 patients on treatment for TB.
Sounds like you're very proud of your hospital. So in terms of the mandate, mission, and vision of rebuilding Haiti's healthcare system, what efforts are being put in place?
The vision for Haiti is to rebuild the nation from the January 12, 2010 disaster into an emerging country by the year of 2030. Efforts to rebuild include creating a fair and just society and creating a dynamic and open economy based on the land. Other efforts include a society where basic needs are met, where there's basic education for all people, and a state committed to the justice and interests of the people of Haiti. This vision was set out by the government of the Republic of Haiti in March in 2010.
Yes, also in addition to the group Vision for Haiti, it's essentially a nonprofit organization who states that their vision for the healthcare system is to provide health services to people living in rural areas of Haiti. Similarly, the Centers for Disease Control and Prevention's main goals are the prevention and treatment of HIV and AIDS, as well as increasing laboratory and strategic information capacity, and also rebuilding the healthcare system in general.
Boehm's classification taxonomy is a way to organize the three dimensions of a healthcare system: financing, regulation, and service provision. Each of the dimensions can be dominated by the state, society, or private actors, creating 27 different possible combinations to classify countries. So, Dr. Stoller, where does Haiti fit in this classification system?
So using Boehm's classification taxonomy, Haiti doesn't actually fit effectively into one specific type. So Haiti can be considered a national health insurance system as well as an etatist private health system. So a national health insurance system is when services are contracted out to for-profit providers. An etatist private health system is where funding and provision is left to market actors, but their interactions are heavily regulated by the state. So an etatist system encompasses three dimensions. So one, the state is responsible for regulating the system. So this means that Haiti is regulated by the Ministry of Public Health and Population, or in other words, by their own state. Two, financing is organized by societal actors. And three, provision is delegated to private hands.
Now we're going to discuss the funding structure. How much of the healthcare system is funded by the government?
The government spends 7.1% of the total public spending on the healthcare system, with 80% of the spending being used for the salaries and 20% used for furniture and drugs.
Does the healthcare system receive funding from anywhere else?
Yeah, so in terms of external financing for the health sector occurs through loans, grants, and NGO support accounts for about 56.7% of total sectoral financing. Also, much of the external funding also comes from countries such as the United States, Canada, France, Cuba, and Brazil as well. Also, USAID is also another organization. It's a U.S. government association that has made a long-term commitment to helping Haiti recover and rebuild as well.
Wow, there's a lot of government organizations that assist Haiti. Do any non-government associations provide funding?
Yes, there's actually quite a few non-governmental organizations, or NGOs is another way to say it, helping Haiti to rebuild. The NGO aid map lists 148 different projects, with 49 of them related to health, 36 of them related to education, and 32 projects related to the economy. The remaining projects target different areas of the nation's needs. So, NGOs include American Jewish World Service, American Red Cross, America's Relief Team, Bridge of Life, Buddhist Chi Foundation, CARE, Church World Service, Combat Blindness International, Convoy of Hope, Direct Relief, Episcopal Relief and Development, Feed the Children, Freedom from Hunger, Global Giving, Global Health Action, Handicap International, Headwaters Relief Organization, Heifer International, IMA World Health, Life for Relief and Development, Lutheran World Relief, Management Sciences for Health, Pan American Development Foundation, Pathfinder International, Plant with Purpose, Project Cure, Salvation Army World Service or Office, Save the Children, United Methodist Committee on Relief, World Hope International, World Neighbors, World Vision US Incorporated.
The healthcare system is divided into 4 sectors: the public sector, the private for-profit sector, the non-profit sector, and the private not-profit sector. All health system facilities are overseen and coordinated by the Ministry of Public Health and Population as part of the ministry regulatory role, or in other words, the state. The Ministry of Public Health and Population is responsible for guaranteeing the health of the population as well as the service delivery, policy making, and health budget. The public sector accounts for 36% of the Haitian facilities. Most other sectors function privately without any input from the state. The mixed nonprofit staff are funded by the state, but regulated by the private sector.
The International Council of Nurses, or ICN, has started a fund for the long-term support and rebuilding of nursing in Haiti. The Haitian nursing regulatory body is l'Association Nationale des Infirmières et Infirmières Licensées de Haiti, or in other words, ANILH. McMaster University has partnered along with ANILH to support joint Canadian-Haiti academic projects to build capacity of academic institutions, provide opportunities for Haitians to resume studying, and to enhance their skill sets.
So how exactly are the services delivered in Haiti?
So essentially, most services in Haiti are delivered by the private sector, which is often linked with religious missions or non-government organizations or NGOs.
And how effective is this service delivery?
So currently, service delivery in Haiti is lacking, as 70% of the country's labs do not even meet international minimum standards. Also, 80% of equipment in public institutions is defective or even out of order.
And Bailey, what is your role of nurse in the system?
So, nurses play a very important role in the healthcare system of Haiti. Prior to 2014, there was not an established curriculum for standards of nursing practice. This resulted in varied nursing education throughout the public and private sectors. Some nurses have been taking on additional roles, such as prescribing medications, making diagnoses, and determining interventions without any additional education. This shift in nursing role has resulted in a nursing workforce that is insufficiently staffed with great variability in skills. This results in a healthcare system that is unequipped to meet the needs of the population. Nurses on average work at 2 or 3 hospitals, making an average of $200 to $300 per month.
Haiti has the highest HIV rates in the Western world, with 130,000 people living with this disease. Although HIV prevalence in Haiti has decreased approximately 40% since 2000, instant pattern suggests that the decline is due to regulation of blood transfusion and high mortality rates from HIV, rather than successful behavior change strategies. Therefore, HIV needs are still not being met. Another health concern in Haiti is child malnutrition.
Nearly 1/4 of children aged 6 months to 5 years old experience chronic malnutrition, which is the major underlying cause of health problems in this age group. Haiti has the highest rates of childhood underweight and wasting in the Latin American and Caribbean region. Child undernutrition has long been a major public health problem and a silent emergency in Haiti. Due to the earthquake in 2010, it put even more children at higher risk of undernutrition. At the end of 2010, the Haitian government and its partners began intensified efforts to scale up preventative community food and nutrition activities. The goal was to increase investments in water sanitation hygiene, in other words, WASH, and immunizations in all of the country's 10 departments. Efforts throughout the country are still in effect, but children are still being affected by malnutrition. Cholera is the third major health concern in Haiti.
From October 2010 to January 2014, there have been a total of 698,893 cases and 8,540 deaths in Haiti due to cholera alone. The cholera epidemic in Haiti occurred 10 months following the 2010 earthquake, which has killed approximately 10,000 people and sickened 800,000 others. This outbreak was caused by a drastic decrease in the levels of sanitation following the earthquake, which caused the epidemic to spread throughout Haiti within the first 10 weeks following the disaster. Today, sanitation practices still remain unaddressed, and many peacekeepers are still not fully solving the issues with wastewater, sewage, and waste disposal protocols. The cholera eradication program, therefore, has failed thus far, and infections continue to be on the rise again since 2014.
Dr. Stoller has created a chart to portray the top 10 causes of death in Haiti. These include stroke, 12%, lower respiratory infection, 8.6%, HIV and AIDS, 8.3%, ischemic heart disease, 6.3%, diarrheal disease, 5.1%, diabetes, 4.9%, interpersonal violence, 3.8%, preterm birth complications, 3.1%, tuberculosis, 2.8%, and birth asphyxia and trauma, 2.5%.
The majority of the Haitian population still struggle to have their needs met since many hospitals and care units are still not fully rehabilitated. Therefore, they have a difficult time working at full capacity. In addition, while many care facilities have received funding and some restructured, many remain empty since trained staff, sufficient drugs, money, and maintenance staff are not fully available. So as a healthcare professional, what kind of barriers do you face?
Healthcare staff in Haiti are overburdened, undertrained, and undercompensated.
Sounds like you have a lot of barriers. How does this affect the service provision?
Before the earthquake, 46% of the population did not have access to healthcare due to poverty and lack of health centers nearby. Presently, there's a shortage of healthcare professionals, including 1 physician and 1.8 nurses per 10,000 people.
Go.
You're gonna have to talk.
That's not loud enough.
Want to introduce yourself?
Hi, I'm Megan Eaglewski. Is that better?
Well, let's do.
Introduce yourself.
Hi, I'm Megan Eaglewski.
Nice to meet you.
It's nice to meet you as well. What did you say?
Sorry, I was like, why aren't you saying something?
Is the Caribbean. I can't do this. I can't. It's hard. And then there's also the Caribbean and Brazilian government who has also been assisting. It's Cuban. Oh. I said Caribbean.
Do it again because you were doing it. It was really well done.
150. I don't know what that number is.
70,000.
70,000.
I have with me today Dr. Chris Stoller, and you're laughing.
No, because this is going to
Our system today. I have with me today Dr. Chris Stoller.
Sorry.
Joining me now is the pharmacist from Partner Hospital. Do you want to introduce yourself?
Hi, I'm Megan Eaglewski.
Was
Was that too loud?
Did you get that?
Yes, I'm Megan Eaglewski. Nice to meet you. The highest HIV rates in the Western world, with 1,000 down in Haiti is child more. Yeah. Sorry.
We could keep that.
You're still recording. This is in Haiti delivered. I don't know where to look. So how exactly are the services delivered in Haiti?
In Haiti?
Healthcare system. I wanted to.
She has a good ear, like stuttering. Sorry.
I wanted to go. Some nurses have been taking on roles such as prescribing medicines, making diagnoses. This may include prescribing medications, making diagnoses.
It's a way to organize the three dimensions of a healthcare system. Financing.
System is when services are contracted out for the I can't read that. Sorry, I'm dumb.